Question 1. Which precaution is most important for a nurse caring for a patient with neutropenia? A. Wearing an N95 respirator. B. Avoiding fresh fruits and vegetables. C. Using alcohol-based hand rubs exclusively. D. Assigning the patient to a semi-private room. Answer: B. Avoiding fresh fruits and vegetables. Question 2. A nurse is caring for a patient with an indwelling urinary catheter. Which action increases the risk for infection? A. Keeping the drainage bag below bladder level. B. Disconnecting the catheter tubing to obtain urine. C. Securing the catheter to the thigh. D. Performing perineal care daily. Answer: B. Disconnecting the catheter tubing to obtain urine. Question 3. What is the best method to prevent transmission of infection when administering an injection? A. Recapping the needle immediately after use. B. Using sterile technique during preparation. C. Cleaning the hub with sterile saline. D. Using one needle for multiple injections. Answer: B. Using sterile technique during preparation. Question 4. When transporting a patient on droplet precautions, the nurse must ensure the patient wears A. N95 respirator. B. Gown and gloves. C. A surgical mask. D. A face shield. Answer: C. A surgical mask. Question 5. A nurse is preparing to perform a sterile dressing change. Which action contaminates the field? A. Holding sterile items above waist level. B. Touching the inside of the sterile package flap. C. Wearing sterile gloves. D. Keeping hands in front of the body. Answer: B. Touching the inside of the sterile package flap. Question 6. What is the appropriate way to handle a needle stick injury? A. Squeeze the puncture site and continue care. B. Apply lotion and continue the procedure. C. Wash the site with soap and water immediately. D. Cover it with a bandage and report at the end of the shift. Answer: C. Wash the site with soap and water immediately. Question 7. What type of precaution is required for a patient with RSV, respiratory syncytial virus? A. Airborne. B. Droplet and contact. C. Standard only. D. Neutropenic. Answer: B. Droplet and contact. Question 8. A patient has suspected Ebola virus. What is the highest level of precautions needed? A. Standard precautions only. B. Contact and droplet. C. Full barrier precautions with negative pressure. D. Contact precautions only. Answer: C. Full barrier precautions with negative pressure. Question 9. The nurse should avoid which action to maintain surgical asepsis? A. Keeping hands above the waist. B. Reaching over a sterile field. C. Opening sterile packages away from the body. D. Using sterile gloves. Answer: B. Reaching over a sterile field. Question 10. A patient with C. difficile should be assigned which type of room? A. Negative pressure room. B. Shared room with same diagnosis. C. Open bay area. D. Protective isolation room. Answer: B. Shared room with same diagnosis. Question 11. When should a nurse change gloves during a procedure on the same patient? A. After leaving the room. B. After the procedure is complete. C. Between clean and contaminated tasks. D. Before documenting care. Answer: C. Between clean and contaminated tasks. Question 12. Which type of hand hygiene is recommended after removing gloves used for C. difficile care? A. Antiseptic wipes. B. Soap and water. C. Alcohol-based hand rub. D. No hand hygiene if gloves are used. Answer: B. Soap and water. Question 13. Which patient should the nurse prioritize to place in a private room? A. Patient with stable diabetes. B. Patient with open, draining wounds. C. Patient with stage eye pressure ulcer. D. Patient with well-controlled asthma. Answer: B. Patient with open, draining wounds. Question 14. Which of the following represents a break in sterile technique? A. Touching sterile gauze with sterile gloves. B. Opening a sterile package away from the body. C. Wearing clean gloves to add sterile supplies. D. Holding sterile instruments below waist level. Answer: D. Holding sterile instruments below waist level. Question 15. A nurse is caring for a patient with shingles. What type of precautions are required? A. Droplet. B. Contact and airborne. C. Standard only. D. Contact and droplet. Answer: B. Contact and airborne. Question 16. What is the best action for a nurse who finds a torn sterile glove during a procedure? A. Continue the procedure. B. Cover the tear with tape. C. Remove gloves and replace with new sterile gloves. D. Put a second glove over the torn one. Answer: C. Remove gloves and replace with new sterile gloves. Question 17. A nurse educator is evaluating knowledge of infection control. Which student statement is correct? A. I will wear the same gown between patients if it looks clean. B. I can use alcohol hand rub after caring for AC difficile patient. C. I should use sterile gloves for oral care. D. I must change gloves between procedures on the same patient. Answer: D. I must change gloves between procedures on the same patient. Question 18. What is the minimum time recommended for hand washing with soap and water? A. 5 seconds. B. 10 seconds. C. 20 seconds. D. 60 seconds. Answer: C. 20 seconds. Question 19. Which of the following is true about standard precautions? A. They are used only for known infections. B. They are used for all patients. C. They eliminate the need for PPE. D. They apply only in ICU settings. Answer: B. They are used for all patients. Question 20. The nurse is educating a patient about infection control at home. Which instruction is correct? A. Use alcohol-based sanitizer after using the bathroom. B. Dispose of used dressings in the regular trash without a bag. C. Wash hands with soap and water before preparing food. D. Avoid hand washing if wearing gloves. Answer: C. Wash hands with soap and water before preparing food. Question 21. Which method is best for disinfecting a stethoscope between patients? A. Rinse with sterile water. B. Wipe with alcohol-based solution. C. Use a bleach wipe and let air dry. D. Spray with perfume to reduce odor. Answer: B. Wipe with alcohol-based solution. Question 22. A patient on contact precautions is ambulating in the hallway. What is the nurse's priority action? A. Allow ambulation without PPE. B. Have the patient wear gloves and gown. C. Cancel ambulation. D. Instruct the patient to wear a surgical mask only. Answer: B. Have the patient wear gloves and gown. Question 23. A nurse is caring for a patient on airborne precautions. Which PPE is essential? A. Surgical mask. B. Gown and gloves only. C. N95 respirator. D. Face shield only. Answer: C. N95 respirator. Question 24. A nurse uses the same stethoscope for every patient without cleaning. What is the primary concern? A. Equipment wear and tear. B. Decreased sound clarity. C. Cross-contamination and infection. D. Allergy risk to patients. Answer: C. Cross-contamination and infection. Question 25. Which patient care activity poses the highest risk for transmission of infection via droplet route? A. Starting in 4-line. B. Administering oral medications. C. Suctioning the airway. D. Applying a wound dressing. Answer: C. Suctioning the airway. Question 26. What action should a nurse take when entering a room of a patient with disseminated shingles? A. Wear gloves only. B. Don a surgical mask. C. Use airborne and contact precautions. D. No PPE is needed. Answer: C. Use airborne and contact precautions. Question 27. A nurse is preparing to remove a urinary catheter. What infection control principle applies? A. Sterile technique is unnecessary. B. Maintain a closed system throughout removal. C. Use aseptic technique. D. Use alcohol hand rub before removal. Answer: C. Use aseptic technique. Question 28. A nurse notes a colleague disposing of contaminated gloves in a regular trash bin. What is the best response? A. Ignore the behavior. B. Report the issue to the infection control team. C. Educate the colleague immediately. D. Document the behavior in the patient chart. Answer: C. Educate the colleague immediately. Question 29. Which is the correct order of removing PPE? A. Mask, gloves, gown. B. Gown, gloves, mask. C. Gloves, gown, mask. D. Mask, gown, gloves. Answer: C. Gloves, gown, mask. Question 30. Which task increases the risk of bloodborne pathogen transmission? A. Wearing double gloves during venipuncture. B. Recapping used needles. C. Using needleless force systems. D. Disposing sharps in puncture-proof containers. Answer: B. Recapping used needles. Question 31. A nurse is teaching about influenza prevention. Which statement requires further teaching? A. I will get the flu vaccine annually. B. I can return to work as soon as the fever subsides. C. Hand washing is essential to prevent flu spread. D. I should stay home when I'm sick. Answer: B. I can return to work as soon as the fever subsides. Question 32. What is the rationale for placing patients with multi-drug-resistant organisms in isolation? A. To conserve supplies. B. To reduce hospital noise. C. To prevent transmission to others. D. To provide more privacy. Answer: C. To prevent transmission to others. Question 33. A nurse preparing for a sterile procedure should complete which step first? A. Don sterile gloves. B. Open sterile supplies. C. Perform hand hygiene. D. Set up the sterile field. Answer: C. Perform hand hygiene. Question 34. A nurse finds a sterile field contaminated. What is the correct next step? A. Cover it and continue. B. Notify the charge nurse. C. Discard and set up a new sterile field. D. Document the incident. Answer: C. Discard and set up a new sterile field. Question 35. What should a nurse do if gloves tear during wound care? A. Continue if hands are not visibly soiled. B. Apply another pair of gloves over the torn ones. C. Remove gloves, perform hand hygiene, and apply new gloves. D. Finish quickly and clean hands afterward. Answer: C. Remove gloves, perform hand hygiene, and apply new gloves. Question 36. What is the most appropriate nurse action to prevent infection when administering eye drops? A. Use a cotton ball for each eye. B. Touch the tip of the bottle to the eyelid. C. Wash hands before and after the procedure. D. Use the same tissue for both eyes. Answer: C. Wash hands before and after the procedure. Question 37. A UAP fails to wear gloves when emptying a Foley catheter. What is the priority nursing action? A. Reassign the UAP. B. Notify the nurse manager. C. Stop the UAP and reinforce correct technique. D. Document the error. Answer: C. Stop the UAP and reinforce correct technique. Question 38. When preparing a sterile field, which item must remain untouched to preserve sterility? A. Outer 1-inch border. B. Inside of the wrapper flap. C. Back of the sterile drape. D. Top center area. Answer: D. Top center area. Question 39. The nurse is assigned a patient with hepatitis A. Which PPE is most important? A. Mask only. B. Gown and mask. C. Gloves and gown. D. N95 respirator. Answer: C. Gloves and gown. Question 40. A nurse is preparing to teach infection control to visitors of an immunocompromised patient. Which point is essential? A. Use the same gown for all visits. B. Limit the number of visitors at one time. C. Bring fresh fruit to help nutrition. D. Visit anytime the patient feels well. Answer: B. Limit the number of visitors at one time. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.